Welcome to The Doctor Will Hear You Now, a podcast featuring our physicians and other healthcare providers telling their stories, sharing glimpses into their daily work and mission, and showing what it means to practice medicine just a little bit differently. Healing you means hearing you, so let's talk. I'm Ben.
And I'm Lexi, and today we're joined by Dr. Lauren Barfield, Senior Medical Director of Adult Primary Care for our health system and a practicing primary care physician with Our Lady of the Lake Physician Group in Baton Rouge. Dr. Barfield talked to us about the importance of primary care, getting established, and just how crucial that relationship is to navigating your health journey. She shared a lot of interesting things that we can't wait to share with you. But Ben, I'm curious, what stood out to you in our conversation?
Just hearing her perspective on why you need to establish that relationship. You want to establish that relationship first, just to kind of get that baseline of care with your provider. But then from that, they can help you navigate into more specialized care and connect you with the right people in the health system. And we both know that kind of navigating that space is somewhat daunting if you're trying to do it on your own. So having that kind of trusted provider there with you, it was really great to hear her perspective on that, for sure. Yeah,
I agree. And as you'll hear too, as we're talking, Dr. Barfield and I are already connected because she's my primary care provider. And so a lot of what we talk about is just things we've already established with our relationship and how she's been a great resource to me. And one thing that she really stressed for those who are scared to go to the doctor or nervous about it, or maybe even had a bad experience before, she talked through just having the courage to try again and find someone else who may match what you're looking for, match your personality or your preference, because really what's the most important thing is to be established and be seeing a primary care provider regularly. With that, I think let's dive into our conversation and we'll share what we chatted about. So welcome, Dr. Barfield. It's so great to see you and connect with you. Thanks for being here today. We're so glad to have you.
Thank you so much for having me, Lexi.
Well, for the rest of us that maybe don't have that kind of relationship with you, Dr. Barfield, if you can just maybe tell us a little bit about yourself and your work at the Lake and how you got into the primary care space.
Sure, I'd love to. So I practice ambulatory internal medicine, which is the fancy word for primary care physician. I did a training through the Earl K. Long residency program. And after 4 years of medical school, you declare what your specialty is going to be. And so I selected internal medicine. There are other tracks to primary care. So family practice is another 3-year track that you can make. And then also, pediatrics for our younger patients and their primary care needs. I chose internal medicine just because I fell in love with complex care, and the program was a wonderful program, and so I just felt like that was the right place for me. Primary care was always my end goal. With internal medicine, there are really kind of 3 options. Many go on to do all of the specialties that we know of. So cardiology, gastroenterology, they all start with 3 years of internal medicine first. Some may stay on in the hospital setting and hospitalists, which I'm very indebted to. I love that we have a wonderful hospitalist team that can take care of my patients when and if they need hospital care. And I'm able to stay out in the primary care setting to meet their needs in the primary care space. And then lastly is, primary care is the track that I chose for my career. So that's, I guess, my track to get to primary care. I really kind of had an interest in it as being a patient myself. So I grew up in a small town, and I really loved the relationship that I had with my primary care doctor. He took care of me, my parents, my grandparents, my aunts, my uncles, because I was from a small town. And it just was really remarkable to me that he was able to take care of all of us and meet all of our needs in all the different ways that we presented to him, and, fellow people in my community. And I just really loved that relationship and that continuity that he was able to see and grow. Actually even went back after my first year of medical school and rotated with him in the summer to learn more about how he took care of his patients and how I could do the same in my practice one day.
That's a great story. That's nice to hear that you were able to kind of go back there and do that work.
Mm-hmm.
Well, and that kind of speaks to something too for our general audience. When we're talking about primary care and a primary care provider, they might hear it referred to in a lot of different ways with like a GP, family doctor. And so you've mentioned internal medicine, you mentioned family medicine, primary care. Is there like an easy way that you use to sort of explain the differences between those for your patients?
Yeah. So, GP is kind of an old term. It used to be in training that you could do medical school and then just do a year of training and then go hang up your shingle. And that's what a quote unquote GP is. There's really not, that doesn't really occur anymore in our current environment. As I mentioned, family practice, that track actually also includes pediatrics and OBGYN. In some cases on the West Coast, they may even do some surgical procedures. When you're in a rural area, and actually my primary care doctor was a family practice physician or is a family practice physician. And so they, family, meaning that they're taking care of all the needs of the family from, and most often you'll hear them say cradle to grave, right? In an urban setting, as pediatric care developed and has become more specialized, you're going to have pediatricians that are really caring for infants to, adolescent, and then, maybe many of them kind of cut off between 18 and 21 years old. And then you're kind of switching. So if a family practice physician practices in an urban setting, they may pick up some of the adolescents, but they often are also taking care of mainly adult patients. And internal medicine usually always starts at about 18 years old, and then up from there. In our internal medicine residencies, really both. We're all trained to take care of chronic diseases. So many patients are aware of diabetes, hypertension, high cholesterol, patients that maybe have had a stroke before or heart attack. But really, most primary care doctors, our goal is to really try to get you before those things happen, right? And so we really would like there to be a good relationship established with a provider that you really trust, so that they know you, inside and out. When something's wrong, they know it. And sometimes we'll refer to that as like the quarterback of the team, right? The quarterback knows all the plays, and they kind of have this overarching view of what's going to happen. And so that's kind of how we see our role as primary care providers, is really trying to get that relationship, and know that patient really well, so that we can help prevent those disease states that we know can lead to long-term chronic disease for patients.
You talked a little bit about kind of that age of when someone would see they're not already being cared for by a family medicine physician or provider, that when they would move into the primary care space at 18. And so I know that's a huge kind of transition for a lot of people. They're so used to seeing their specific pediatrician. And I know a lot of my friends or family members of people I talk to are kind of like, well, I never, I didn't even think about primary care, or I'm not even sure really what that means. And so a lot of people from 18 to maybe even into their 30s and 40s go without having that quarterback, so to speak, like you said, kind of helping them guide the plays in their health journey. And so tell us a little bit about all the ways that having that PCP when you are 18 and beyond can really help our listeners, and why that's so important in some of that preventative care that you talked about.
Yeah, sure. I think, if you think about any relationship that you have, you wouldn't just walk up to somebody brand new and just tell them your deepest, darkest secrets, right? You wouldn't necessarily ask them to come on vacation with you. You just met them, right? And so if you think about your health and how important that is, people are very specific about the mechanics they use, the dentist they may use. And so your health is so personal, and it's really very precious as well. There's, we have to take good care of it. And so I think, we are kind of mandated to do our pediatric care because we have to get vaccines to go to schools and things like that. And then there's kind of this drop off, like you said, where there's not a whole lot of cancer screenings that we're doing necessarily. Maybe you're seeing an OBGYN as a female, but largely our male population is not really mandated to do anything. So, but that being said, we have lots of things that can be happening. Your blood pressure is not something that you feel necessarily, and that can be creeping up through the years. We know that cholesterol is not something that you can feel. It's something that would need to be tested. Same with blood sugar. Now, if someone has extreme, highs or lows of some of those things, then you may have some signs. Many of us have family history, and we don't think about asking about that. So while everyone got used to the 50 for colonoscopy, not knowing their family history, really, they could have been missing a gap of really up to 10 years and a polyp that could then become cancer if they would have had that primary care physician helping to navigate those things with them to understand, yes, we have population recommendations, but Lexi, what are your recommendations? And that's very personal to you. Outside of those things that we think about, like cholesterol and all, there's life events that happen, right? Some of us lived through a pandemic. And it was a very scary time for a lot of people, and not having somebody that they trusted to help navigate these waters of uncertainty. I know a lot of patients were very thankful to have, already established that relationship when they started to have symptoms or they needed to follow up. So we don't know when that next thing is going to be. And, I definitely am very grateful to have my own primary care doctor to be able to reach out whenever something new or different is happening that I'm familiar with.
Yeah, I love how you use that. It is so personal. And I know that's what I love about our relationship is I don't have to start from scratch every time I come and see you. And have to say it really was helpful just in the pandemic of managing different anxieties, and to know that you were a trusted person to come to help navigate all of those things. So I think personal is really the best way to put it, at least how I feel as a patient.
Yeah, I'm glad. We do too, right? I say that I see some of my patients more than I see my family members, right? And so they become family to us. And that's why
we want the best for them, just like we'd want for our own family and our own friends. And so that's why I think it's such a special really vocation. I mean, I feel very, very blessed to have the opportunity to do this. I've learned, about pregnancies before anyone else knows. I've, learned about upcoming weddings, and I've traveled through very sad things, with deaths in the family. Those are very sacred, special moments that can impact someone's health. And so we're, blessed to be a part of that.
Yeah. Well, and I also heard you say this earlier, and I wanted to repeat it again because I thought that was a good point. Your primary care provider also has their own primary care provider that they go to. It's a good point.
We practice what we preach.
Yeah. Well, we talk a lot about how establishing with a primary care provider is your investment in your own health, but it also has that financial investment too, because that preventive care is saving you money in the long term. So can you talk a little bit about what that means for a patient and how they are saving in the long term?
Yeah, sure. So, I mean, many disease processes, as I mentioned, like diabetes and hypertension, are kind of ubiquitous in the, people know what that is, but maybe don't think about the long-term end results of those. So if we don't keep your health in check and those disease states get away from us, it starts to compound the financial strain on a family. Unexpected late stage cancer diagnoses, a stroke that takes a dad away from his previous employment because he no longer can perform those tasks anymore. A heart attack that maybe takes the life of a family member. It not only impacts, the acute cost that we have to spend to care for that patient and rehabilitate them, but it may have long lasting impacts on the trajectory of that family and where they go. We know that healthcare really is a high expenditure, high reason for bankruptcy. And so just like I said, if you got a brand new car, your dad or your mom or someone trusted tells you you've got to change the oil, right? You've got to service your car. You've got to get the tires checked. And if you don't, then it's expensive because then you end up having to replace a lot of things or you can't even use it anymore, right? And that's just a a car. So we should be investing that much time and energy on the preventative side of our own health.
Definitely. I think that makes a lot of sense. And I know I can definitely do better about taking care of my car. It was a good reminder. You made me think, oh, I don't know the last time maybe that I've done some of those things. But I think to your point too, even with that, I hear a lot of people, especially around my age group, of, oh, well, if I get sick, I'll just pop into an urgent care, or I can just be seen that day. Can you debunk a little bit about that for us of, with primary care, if you're established, you can be seen that day, right? If urgent needs come up, or maybe even not seen that day, but seen that week, or message, or some type of touch point, with someone who has an established relationship with you and not a new person that you would walk into at a urgent care clinic type style.
Sure. I definitely think that we all are working together as a team to try to provide the best healthcare possible to our patients. And, certainly I can't be in the clinic 24/7. So there is a place for our urgent care partners for sure, and our emergency room departments.
But again, your primary care doctor, if you've established that relationship, really knows all the ins and outs of what's going on. They have access to a unified electronic medical record, so they know what your past history is. And in a busy urgent care setting that doesn't have access to your past record, if you're not feeling good, you may not remember or be able to recall all the things that you've had before, or the medicines you're taking. That can all be implications into what's going on with you. So I think that's one thing that's important as far as being accessible. Again, it's having a relationship. And if you have a good primary care doctor, they're usually going to be accessible through your portal, through, if not them directly, someone on their team, again, that is well-versed in your history, your care, your story. Right. And that really makes an impact on, is this the right antibiotic for you? Should we be giving you steroids? Because all of the things that we do have an end result that we want to make sure is the best for you.
Yeah, definitely. And I think even when you are seen by your primary care provider, or if you are, let's say, have something that needs more of that specialty treatment or a different type of specialist, can you talk about how your role as a primary care doctor still plays a part, even when a patient may need to see a specialist, or how are you connecting them with the right people to make sure they're cared for throughout anything that would pop up?
Sure. Of course, we try to do the best we can to care for everything, but if, like you're mentioning, there are going to be things that come up that need the next level of care. And so that's one wonderful part about being a part of Our Lady of the Lake. We are just so blessed with a wide variety of specialists across all disease states. And so I have access to many of them, really by picking up a phone and making sure that my patients get the care that they need. We also meet regularly. We, try to engage with when new people and understand what each other's specialties are. What do they have to offer? What's new and upcoming? We have many multidisciplinary teams that meet. They invite the primary care doctors so that even whenever it is a high level subspecialized care, that we can be a part of it if we choose to be able to understand what are the next steps in this cancer diagnosis. What does radiation look like? And how's the surgery going to go? And who's the best person to take care of my patient, my person that has entrusted their care to me.
Yeah, I think that's really an advantage of being part of such a big system that we have, is that you're able to stay connected with any specialist that you would connect your patients with seamlessly. I think one of the big specialty areas, especially of course for women, is that OBGYN care. And a lot of women use see their OBGYN kind of as their only doctor, but we know that there's more than, just your lady parts that need care, right? There's things outside of that maybe the OBGYN isn't specialized in treating or knowing about. And so can you talk a little bit about why it's so important that you do need an OBGYN or a gynecologist, but you also need a PCP? They're not interchangeable for one another. And maybe talk through what are some of those differences for people to understand.
Yeah, sure. So as you mentioned, OBGYNs
really for a time, and in some cases still may provide some primary care to patients, but they are extremely busy with babies and surgeries and all of that. So many of them will refer to us to help them navigate the other elements of care. We do work in concert, communicating with one another about making sure, do you have this cancer screening, or am I going to take care of this cancer screening? Again, the more we become connected on the electronic record, that's really helped with that. But I do think that largely they are not managing cholesterol. They're not managing diabetes. It depends on the comfort level or the time constraints that the OBGYN has on how much they would like to engage in. And so usually they'll reach out to us if there's something that they feel they really need primary care for. But I think it's that it's not an either or, it's an and both, like we need both of them. And it's important to making sure you're having the total care that you need.
We know consistent check-ins with your OBGYN are essential for women's health, but we also think women are more than the sum of their lady parts. Even with regular OBGYN exams, annual primary care visits are important for you to check in on illness, injury, or any other chronic conditions.
Primary care is personal. Good health starts with a provider who listens and gets to know you. At Franciscan Missionaries of Our Lady Health System, you can experience the difference of having a dedicated healthcare partner by your side. Find a primary care provider who is ready to hear your story. Visit findmypcp.com.
Well, like I mentioned before, I am one of your patients and have gotten a lot of care at your primary clinic, and then also in the care team that's offered through the physician group. And so one of the things that I think your team has really, and you especially, have been so helpful with is, as you know, when I started coming to you, I was scared of going to the doctor. And so you really helped kind of navigate through those fears and put me at ease. And I know a lot of that starts with listening, and building that trust and building that relationship. And those are things that I've just appreciated in our relationship. And can you tell our listeners a little bit just about your approach to building trust and why listening is so important to caring and making sure that concerns are addressed when patients come and see you?
Sure. I mean, again, I think it goes back to
just learning from really great teachers. I've, throughout my training, understanding that, we're treating people, not just disease states, right? And you have to understand someone's whole story to be able to understand how to best care for them. And so I usually do try to spend as much time as I can in that first visit to really try to get as much information as I can to understand that patient, so that we can start that relationship where we can have a trust that because if a patient doesn't trust you and they're withholding things, then I can't care for them in the exact way that they need to be cared for. So I think that's really important. And that may not be in the first visit. It may take 2 or 3 visits, maybe even more in some cases, for there to be that level of trust. And, we're very lucky in our community to have so many wonderful primary care doctors. So I do think, for every patient, it can be different. Some people are talkers. I'm a talker, but not everybody's a talker. And not everybody's, some people relate better to women, or some people relate better to men. But I think at the end of the day, you need to feel like you have a good relationship and that you trust the person that you're working with and their team. That's important too, so that you can get your needs met and we can move forward and have a healthy, long relationship together.
Yeah, that's great to hear. Are there ways that you're able to sort of like maintain that relationship with the patient between appointments, even like a patient that might only see you once a year for annual checkup? I know we've talked about some of like the online tools that we use through like My Chart just to keep that conversation or keep in touch. So what are some examples of ways that you or your team or the clinic is able to kind of keep updated with that patient in between visits?
Yeah, sure. So, I mean, My Chart portals have been very helpful in maintaining that quick access. I think many patients, at first, I think there was a lot of angst about it, but I think it's proven to really be a great resource for patients So that's one way. I think the advent of video visits has been really helpful too, because sometimes it's just, they're just not feasible for them to come in, but we can potentially interact and engage in meaningful conversation and get what they need through a video visit. And so that's helpful, and that's quicker, than a in-person visit. Other than that, I know that, we engage just as a health system in other health related events in the community. And I think it's good, for us to be a part of that, so that patients see that, again, that we really do mean what we say when we're talking about doing the things that are needed to maintain our health, whether that's, being involved with colon cancer education, or, women's wellness days or men's wellness days. So I think, that's another way that our providers try to stay engaged with the community as well.
Could you maybe share with us a story about a patient interaction that you've had, or someone who sort of discovered the importance of having a primary care provider, and how that might have had a big impact on their life and their health outcomes going forward?
I know all of us are tired of hearing about COVID, I'm sure, and the pandemic, but one patient that specifically I know, reached out and said that it was very helpful, is in kind of the height of the pandemic, got diagnosed with COVID, and the urgent cares were doing all they could to help us. And certainly we're very glad to have them. But, they really could only, with the volume of patients coming through, would be diagnose you and then you had to go. And, when you're young and you're, wasn't sick enough to be admitted to the hospital, but still scared and not sure about what this could lead to, we were able to stay in contact. He already had that relationship with me. And so, when it was all over and he was able to recover, was just really thankful that was a relationship that he had, because there was really nowhere else. Everybody was so busy with it. There was really nowhere else for him to feel like he could turn. But since we had already had that relationship, he could feel confident that, that he was being taken care of. So I think that's one example. Another, just from, not maybe a specific example, but when Lexi mentioned the younger population, certainly, easy to go in when you're having just a sore throat. But I remember talking to a young, actually, physician, and he was like, "Oh, my generation, we're just going to go to urgent care. We don't need a primary care doctor." And I said, it's great to have, for sure. But what about when something happens in your life that you really, you really are feeling down, and you need somebody to help you, manage depression or anxiety, or, a scary outcome of something that went to after you went to the urgent care and you aren't able to go back. That's not something that you're going to be able to quickly, as Lexi mentioned, go in and feel comfortable just, unloading all of that with somebody that you've never met before. And so I think, again, it goes back to primary care being the foundational relational medicine, I guess, so that you have what you need to be prepared for what life's going to bring you,
Yeah, definitely. Thanks for sharing that, because I think it's maybe not a myth, but maybe a misconception, or just something people don't know, is that primary care does cover and help you through any anxieties or depression or managing that, or can point you in the right space. And so I'm really glad that we could share that with our listeners, so that if they are struggling with any of those things, to know, like, now's the time, get established, start building that relationship, because someone can be there to help you through that.
Yeah, for sure.
Well, in your role with leading primary care across our health system, we're always curious about what's next for healthcare, right? Like, what's going to be the new technology? What's going to be the things that we're going to innovate through? And our health system's really good at kind of looking ahead at that. And so I'm curious of, just in your space and your leadership role, of are there anything new on the horizon, technology wise, or impacts on the practice of primary care that you're excited about to shape patient experiences?
Yeah, sure. When you talked about access, and our digital health team is really working hard to implement on-demand visits
to meet those, needs of immediate need. And again, it may not always be your primary care doctor, but it's someone who's well-versed on your care. We also have virtual extended hours, which is allowing our patients to enter in again through our EMR to be able to see providers extended past the time that I would be in clinic. So that's helpful. I know that, in competitive spaces, there are the Amazons of the world and the Costcos of the world that are reaching out and trying to enter into that space. But again, it goes back to having that relationship and being with somebody that's in your community, right? So the needs of a person in Baton Rouge, Louisiana could be vastly different than the needs of someone in California or North Carolina. They don't know the specialists here. They don't know what your resources are that are available to you. And while all of these innovations can be helpful, I still think it goes back to having a one-on-one human interaction with someone else. But we are looking at, what does digital health have to offer as far as like remote monitoring for our blood pressure patients. The advent of continuous glucose monitoring for our diabetic patients has been great to really help us get those patients under better care for a longer period of time. So those are some of the things that we're looking at.
Yeah, that's some fascinating stuff. Some interesting developments that we'll be able to watch as they come through. So switching gears a little bit here, we're kind of to the end of our questions. And this is something that we ask every guest that we have on the podcast. So what's something, we're talking about hearing, we're talking about listening. So what's something that you've been listening to lately? And it can be another podcast. It could be music you're really into right now. It could be on the personal side, it could be on the professional side, whichever. We're just always interested to hear what our providers are listening to.
I have 5 kids, so I don't have a lot of time to listen to things. My favorite podcast that I've done recently is Father Mike Schmidt's Bible in a Year. So for me and my walk, I feel like I've been blessed to be an instrument to help patients. And for us in our health system, that also includes spiritual health. And so I think it's important for my spiritual health to be good. And that started at the beginning of the pandemic, and it really was just a very good comfort for me. And I learned a lot. And, so I think it's helped me to have a good perspective as I'm treating my patients going forward.
That's a good example.
That's so nice. And we'll have to call that one out for the listeners if they want to catch that one too. It sounds like a really, I don't know, it seems like it could be good for your whole soul, right? To listen to that every day, and always looking for a good one, for a good walk podcast for sure.
Yeah, he's awesome. He's really dynamic, and he reads some of it and then he explains it to you, which I think, if you just try to read the Bible cover, it's
It's a lot.
Yeah. So it's good to have a little navigator.
Definitely.
Well, we're very close to wrapping up, but is there anything else you want to share with our listeners that we might not have covered during this podcast?
I would just say that, just like Lexi shared, don't be scared of taking the first step to take care of your health. It's something we can't get back. It's something that's precious to us since, the day we're given it when we're born. And if you've had a bad experience in the past that's keeping you away, just, try again. Try to find that right match, because, every day is precious, and every day that we can maintain your health to prevent preventable things that can keep you here with your family for years to come is worth every minute. So I just encourage patients to really take that next step. Log on, find a way to get to a good primary care doctor and start that relationship.
That's wonderful. That's great advice and a great note to leave our listeners with. Thank you, Dr. Barfield, for joining us today. It's always great to see you, and we appreciate you taking the time to chat.
All right.
Thanks so much.
Thank you, guys.
And listeners, thanks for tuning in. We'll have everything that Dr. Barfield mentioned and other resources linked in the show notes below. We'll be back soon with more episodes of The Doctor Will Hear You Now, a podcast from Franciscan Missionaries of Our Lady Health System.
And if you have ideas for topics you'd like to hear on the show, email us at podcast@fmolhs.org. Thanks for listening.